Breast tissue changes develop silently. Early cancer shows no symptoms, making regular self-awareness absolutely critical for every woman. Healthy breast versus one with cancer. See the hidden difference. Most women cannot feel a lump this small. Multiple tiny tumors can grow at once inside breast tissue. Your fingers might miss these early warning signs completely. Cancer begins inside milk ducts as single abnormal cells. This microscopic change happens without you feeling anything yet. Upper outer breast quadrant near your armpit develops most cancers. Check this area carefully during your monthly self-exam. Skin looks normal externally, but cancer hides beneath. You cannot see or feel early disease without proper screening. A dormant cancer awakens inside a milk duct. This transformation happens silently inside your body right now, possibly. 4 risk factors affect your breast health: genetics, lymph nodes, nipple changes. One unknown factor remains hidden from you. Tumors grow slowly over months or years. Early detection saves lives before cancer spreads beyond breast tissue completely. Do you examine your breasts correctly each month? Most women miss subtle signs hidden deep within their own tissue. Normal breast tissue contains milk ducts, glands, and fat. Knowing you're normal helps you notice changes early. One breast cell mutates, becoming abnormal. This single moment happens inside women daily without their knowledge. Abnormal cells divide uncontrollably, creating copies. Your body loses ability to stop this dangerous process naturally. 50 abnormal cells now crowd inside milk duct. This stage, called DCIS, remains completely undetectable by touch. Cancer builds its own blood supply, stealing nutrients. This process, called angiogenesis, fuels continued tumor growth silently. Growing tumor distorts milk ducts and nearby fat. Breast architecture changes internally before you feel anything wrong. Skin looks perfectly normal above growing cancer. You cannot see internal changes during self-examination at home. Tumor sits centimeters beneath skin surface, hidden. Mammograms detect this, while manual exams find nothing yet. Early breast cancer develops without any symptoms. Regular screening catches disease before it threatens your health seriously. Tumor reaches 1 centimeter, growing silently inside. This size remains too small for most women to feel during self-exam. Cancerous lumps feel irregular with jagged edges. Benign lumps feel smooth and move easily under your fingers. Cancer cells break through duct walls, invading breast tissue. This process, called invasion, allows spread beyond original location. Mammograms show cancers as irregular white spots with spicules. Smooth, round spots usually indicate benign cysts instead. Compare irregular cancer with smooth, benign cyst. Your doctor distinguishes these through imaging and biopsy sampling. Skin dimpling occurs when cancer pulls on ligaments. Check your breasts monthly for any new skin changes. Nipple retraction or inversion signals underlying tumor. Any new nipple changes warrant prompt medical evaluation immediately. Orange peel skin appearance means advanced lymphatic involvement. This visible change requires urgent medical attention without delay. Visible breast changes mean cancer grew significantly. Regular mammograms catch disease years before these signs appear. Cancer cells break away from main tumor, entering lymph vessels. This process, called lymphatic spread, carries disease toward lymph nodes. Lymphatic vessels transport cancer cells like highway traffic. Your lymphatic system connects breast to armpit lymph nodes directly. Sentinel lymph node receives cancer cells first. Surgeons biopsy this specific node to determine spread. Cancer grows inside lymph nodes, replacing normal tissue. Enlarged hard nodes under arms suggest possible metastasis. Cancer spreads through lymph node chain progressively. More involved nodes means more advanced disease requiring stronger treatment. Breast cancer becomes regional when nodes involved. Treatment then requires both breast surgery and systemic therapy. Cancer cells invade blood vessels from lymph nodes. This allows distant spread to bones, liver, lungs, and brain. Blood carries cancer cells throughout entire body. Heart pumps potentially deadly cells to every organ system. Lungs receive cancer cells first from bloodstream. Lung metastases cause cough, shortness of breath, and chest pain. Breast cancer spreads to lungs through bloodstream, causing nodules. Shortness of breath or cough requires immediate medical evaluation. Liver metastases occur when cancer cells travel through blood. Abdominal pain or jaundice may indicate liver involvement. Bones provide fertile ground for breast cancer growth. Spine, ribs, and pelvis are most common metastatic sites. Cancer destroys bone tissue, creating painful, lytic lesions. Fractures occur easily when bones weaken from metastatic disease. Multiple bone metastases require systemic treatment, including chemotherapy. Radiation helps control pain at specific sites. Brain metastases cause headaches, seizures, and neurological changes. Breast cancer patients with symptoms need brain imaging promptly. Liver metastases disrupt critical body functions. Appetite loss, weight loss, and jaundice signal possible liver involvement. Breast cancer staging requires scanning lungs, liver, bones, and brain. PET-CT and bone scans detect distant spread. Metastatic breast cancer affects multiple organs simultaneously. Treatment focuses on control quality of life and survival extension. Breast self-exam monthly helps you know you're normal. Feel for new lumps, thickenings, or changes systematically each month. Clinical breast exam by doctor covers entire breast area. Annual exams complement mammography for complete breast health screening. Mammography compresses breast tissue for clear images. Slight discomfort temporary, but cancer detection saves lives permanently. Mammogram shows tumors as irregular white spots. Radiologists compare current images with prior studies for changes. Biopsy samples, suspicious lumps for definitive diagnosis. Ultrasound guidance ensures precise needle placement into abnormal tissue. Core needle biopsy removes small tissue samples. Local anesthesia numbs skin, so procedure causes minimal discomfort. Biopsy specimen travels to pathology laboratory. Experts examine tissue under microscope for cancer cells. Pathologists determine cancer type, grade, and receptor status. This information guides your specific treatment plan. Pathology report reveals tumor characteristics completely. Your doctor explains results and recommends appropriate treatment options. Lumpectomy removes cancer while preserving your breast. Surgical markings guide precise incision over the tumor location. Surgeons visualize tumor directly during lumpectomy procedure. Healthy tissue margins ensure complete cancer removal verified by pathology. Removed tumor travels to pathology for margin analysis. Clear margins mean no cancer cells left behind in breast. Breast heals after lumpectomy, maintaining natural shape. Surgical clips mark area for radiation therapy, targeting remaining cells. Mastectomy removes entire breast tissue completely. Choose based on tumor size, genetics, and personal preference with your surgeon. Chest wall after mastectomy shows muscle only. Reconstruction options restore breast shape immediately or delayed. Radiation targets lumpectomy site precisely daily. Treatment kills microscopic cancer cells, preserving breast long-term. Radiation damages cancer cell DNA, causing death. Healthy cells repair themselves better than cancer cells recover. Healed breast shows no remaining cancer after treatment. Regular follow-up monitoring ensures early detection of any recurrence. Breast cancer can recur years after successful treatment. Regular mammograms and self-exams remain essential for survivors lifelong. New DCIS develops in treated breast, requiring vigilance. Early detection of second cancers saves lives again. Opposite breast needs equal screening attention. Annual mammograms of both breasts continue after treatment forever. Lymph node status guides recurrence treatment decisions. Sentinel node biopsy may be repeated if new cancer appears. Surveillance mammograms detect new cancers early. MRI added for dense breasts or high-risk patients annually. Hormonal therapy blocks estrogen, fueling cancer growth. 5 to 10 years medication reduces recurrence risk significantly. Aromatase inhibitors weaken bones over time. Bone density monitoring and supplements protect skeletal health during treatment. Some chemotherapy affects heart muscle function. Cardiac monitoring ensures heart health during and after cancer treatment. Breast cancer survivors need comprehensive follow-up care. Monitor for recurrence, manage side effects, maintain healthy lifestyle. Breast cancer treatment leaves permanent changes inside you. Your body heals, but scar tissue remains forever. Lymph node removal risks lymphedema, arm swelling. Protect your arm from blood draws, injections, and injuries lifelong. Lymphedema causes permanent arm swelling, requiring management. Compression sleeves, manual drainage, and exercise control symptoms effectively. Tissue expanders gradually stretch skin for reconstruction. Saline injections over months prepare space for permanent implant. Silicone implants restore breast shape after mastectomy. Implants feel different than natural breast tissue but look natural. DIEP flap uses your own tissue for reconstruction. Belly fat becomes new breast with natural feel and appearance. Nipple reconstruction and tattooing complete breast restoration. Final details create natural appearance matching opposite breast. Breast cancer journey spans detection through survivorship. Each phase brings unique challenges and medical care needs. Early detection saves lives through regular screening. Schedule mammograms annually and examine breasts monthly starting age 40. BRCA genes normally protect against breast cancer. Everyone carries these genes functioning as tumor suppressors. BRCA1 mutation disables DNA repair completely. Cells accumulate damage, leading to cancer development over time. Normal cells repair DNA damage automatically. BRCA mutation leaves DNA vulnerable, causing cancer risk 70%. Hereditary breast cancer often strikes younger women. Multiple tumors, both breasts, require different treatment approaches. BRCA mutations raise ovarian cancer risk significantly. Fallopian tubes also develop cancer, requiring preventive removal consideration. Family history of breast ovarian cancer suggests genetic link. Multiple affected relatives warrant genetic counseling referral. Genetic testing requires simple blood draw only. Results guide personalized screening, prevention, and treatment decisions. Preventive options include enhanced screening, medications, or surgery. Choose based on personal values and medical guidance. Knowledge of genetic status empowers health decisions. Discuss family history with doctor to assess your risk. Inflammatory breast cancer blocks skin lymph vessels immediately. This causes breast redness, swelling, and warmth without lump. Peau d'orange skin looks like orange peel texture. Cancer cells blocking lymphatics cause this distinctive clinical sign. Inflammatory breast cancer grows in sheets, not lumps. Mammograms may miss disease, requiring clinical suspicion and biopsy. Inflammatory breast cancer spreads rapidly over weeks. Any persistent breast redness requires immediate medical evaluation. Skin biopsy diagnoses inflammatory breast cancer definitively. Finding cancer cells in lymphatics confirms this aggressive type. Inflammatory breast cancer always locally advanced. Diagnosis. Treatment requires chemotherapy, surgery, and radiation combined. Chemotherapy first shrinks inflammatory breast cancer. Neoadjuvant approach improves surgical outcomes and survival rates significantly. Mastectomy removes entire breast and involved skin. Wide excision ensures all cancer cleared from chest wall. Aggressive treatment cures some inflammatory breast cancer. Early recognition and prompt care save lives from this disease. Breast cancer recurs years later as metastatic disease. Bones, liver, lungs, and brain are common spread sites. Bone metastases weaken structure, causing pain, fractures. Spinal lesions risk cord compression, requiring emergency treatment. Liver metastases replace healthy tissue gradually. Jaundice, abdominal pain indicate progressive liver involvement needing treatment. Lung metastases cause shortness breath and cough. Nodules appear on chest CT during routine surveillance scans. Brain metastases cause headaches, seizures, confusion. Radiation and surgery control symptoms and improve quality life. Metastatic breast cancer affects multiple organs simultaneously. Treatment focuses on control, not cure lifelong. Palliative radiation relieves bone pain effectively. Targeted beams shrink tumors. strengthening weakened bone, preventing fractures. Cancer evolves, developing treatment resistance over time. Multiple therapy lines needed as disease adapts continuously. Living with metastatic cancer means ongoing treatment. Quality of life focus balances disease control with daily living. Palliative care focuses on comfort and quality life. Pain symptom management becomes primary goal when cure impossible. Bone pain requires multimodal approach for relief. Medications, radiation, and nerve blocks work together, controlling discomfort. Breathlessness from lung metastases needs oxygen support. Medications ease breathing anxiety during advanced disease stages. Liver failure causes jaundice, confusion, and decline. Hospice team manages symptoms, ensuring comfort and dignity always. Brain metastases eventually affect consciousness and awareness. Family presence and gentle care provide peace final days. Heart slows naturally as life completes journey. Peaceful passing occurs when body ready, releasing spirit. Physical body rests, but memory and love remain. Legacy lives through family words and impact left behind. Legacy planning creates meaning beyond disease duration. Time with loved ones, photos, journals, preserve your story forever. Your health matters now. Prevent cancer through screening. Early detection saves lives. Honor yourself and those lost. Healthy breast tissue shows normal glandular and fat. Knowing you're normal helps detect changes needing evaluation. Breast cancer risk factors include age, genetics, lifestyle. Some risks modifiable. Others require increased screening vigilance. Healthy cells repair DNA damage automatically daily. Antioxidants from diet support natural cancer prevention mechanisms. Dense breast tissue increases cancer screening difficulty. Ask doctor about your density and supplemental imaging needs. Mammography screening guidelines vary by age. Discuss personal risk with doctor determining optimal schedule. Monthly self-exam helps you know normal tissue. Systematic palpation covers entire breast, including armpit area. Warning signs include lumps, skin changes, discharge. Any persistent change needs prompt medical evaluation. Early detection saves lives through treatment options. Even advanced disease managed with modern therapies effectively. Your breast health matters. Prioritize screening today. You have power to influence your outcomes. Breast health connects to overall wellness. Completely. Whole body approach includes healthy lifestyle and regular medical care. Breast cancer journey spans prevention through advanced disease. Knowledge empowers you at every possible stage. Early detection literally changes outcomes from death to cure. Screening and self-awareness save lives absolutely. Modern breast cancer treatment offers multiple options: surgery, radiation, chemotherapy, hormonal targeted, and immunotherapy available. Personalized medicine tailors treatment to your cancer. Tumor testing determines which therapies work best for you. Clinical trials advance breast cancer treatment continuously. Discuss research options with your oncology team always. Breast cancer survivors thrive after treatment ends. Ongoing surveillance and healthy lifestyles support long-term wellness. 7 pillars protect your breast health forever. Know, screen, live, listen, see, act, value yourself. Your health matters. Early detection saves lives. For yourself, loved ones, and all women, prioritize